Thank you for the kind invitation to speak to you today on how to convey messages about vaccine safety at the International Workshop on COVID-19 vaccines. I'm Associate Professor Margie Danchin from the Murdoch Children's Research Institute and the Royal Children's Hospital and University of Melbourne in Australia. Before I get started, I would like to acknowledge the traditional owners on the lands of which we are meeting today, which for me is the Wurundjeri people of the Kulin Nation, and just pay my respects to elders past, present and emerging. So in this talk today, I'm going to be talking a little bit about the factors that are important in risk perception when we discuss vaccine safety and what we use to understand and assess risk. And then I'll touch a little bit on risk communication in the clinic and then more broadly in the community. So when we communicate about vaccines, it's a delicate balance. We're trying to communicate with people to reassure them, to encourage them to accept vaccines. And we try and do this in a tailored way between different populations. And then on the other hand, we are trying to convey messages around the safety and the effectiveness of the vaccines and to provide a unified message, but not to oversell vaccine safety and to be a bit cautious. So there are a number of key elements that are important in risk perception. The first is our own personal circumstance. So our perceived vulnerability or eligibility for vaccines, our own medical history, any underlying chronic medical conditions, for example. The second is the feature of the risk. So, for example, with the adenoviral vector vaccines and the clotting syndrome, TTS, or thrombosis with thrombocytopenia, that was certainly portrayed in the media as having catastrophic potential. It received a lot of media attention. It caused a lot of fear and alarm, and that in itself amplified the risk in people's minds. Then there's heuristics or mental shortcuts that we use, and I'll discuss those in a minute. And of course, that is underscored by our own personal values, such as how we perceive fairness, how important justice, self-determination, neighbourliness are to us, for example. So just to touch a bit more on heuristics, and these are the mental shortcuts that we use to interpret risk, and they are underscored by our personal values and also how we think and feel, and that determines how we act on the risk. So here I have an image of a shark, and this is how many people perceive a rare adverse event that may be associated with a vaccine, such as TTS or the clotting syndrome with the AstraZeneca vaccine, for example, or perhaps myocarditis with the mRNA vaccines. The amplification of this risk in the media is what we call availability bias. So people are bombarded with messages about the risk, it is amplified. And so a serious but rare adverse event is given more weighting if it is highly publicised, and that affects how we act and feel about that risk. Then there's omission bias. So this is really, again, the sorts of information that people are accessing tend to confirm their beliefs about a vaccine and vaccine safety. And so they prefer to accept an outcome from doing nothing, so not getting vaccinated, for example, rather than doing something, which is choosing vaccination. So here is an image of people putting their head in the sand and just choosing to do nothing and not get vaccinated. So it's really important to recognise that when people are deciding upon vaccination for themselves or for their children, that vaccine acceptance exists on a spectrum. And you can see here right from people who are actively rejecting vaccines or activists that are promoting others to reject vaccines, from those who are more hesitant or have strong concerns about the vaccines or maybe cherry pick or selectively vaccinate, to those in the middle who accept vaccination And then up the other end, people who are strongly demanding vaccination or advocating very strongly. And you can see in the white boxes there the tailored approach that is recommended depending where you sit on the vaccine acceptance spectrum. And in this talk, I'm going to focus a little bit more on how we communicate with people who are hesitant about vaccination, because we know that we can shift those people who sit on the fence to accept vaccination. You will see there with the vaccine acceptors in the middle that the main goal of the vaccine conversation is to maintain good consent to ensure that they still understand the risks and benefits of the vaccines as they accept vaccination. So when we are communicating with our patients in the clinic or with parents of children under the age of 5 around vaccination, it's important the approach that we take. The first step is really to help people understand the risk of the vaccines. We know that everybody has questions. So to help them assess their own or their child's personal eligibility, to understand that person's medical history, why they may be at higher risk of an adverse event, and really step them through that process of weighing the risks of vaccination against the benefits. And a healthcare provider recommendation is absolutely key. It is the number one thing that will really shift someone to accepting a vaccine. It's important that we don't only talk about how vaccines protect us from becoming unwell or seriously sick, but also that we consider the broader benefits of vaccination. And I'll touch on that a little bit more in a minute. And of course, our communication always needs to consider health literacy and be culturally appropriate. So there are a number of resources or aids that we might use to have these sorts of conversations. Decision aids in particular are extremely helpful. And I've been part of a group with the National Centre for Immunisation Research and Surveillance here in Australia to create a decision aid around COVID vaccination for adults and for parents deciding about the vaccine for their children. In the middle is a culturally appropriate resource that has been developed for individuals from Aboriginal communities. And then on the right, you can see there another type of resource that I've been involved in developing through the University of Melbourne called VaxFacts. And that is really a series of short videos that answer questions that people have about the vaccines, anywhere from 60 seconds to a couple of minutes, because some people prefer to visually learn information or have their questions answered rather than read information. So the key here is whether we use visual or verbal formats, that we really try and communicate the magnitude of the risk to people, not the acceptability, that is up to them in their decision making, and that we always try and tailor our communication as much as possible. So here I've touched a little bit more on the decision aids, and I encourage you to have a look at the NCIA's website if you'd like to. And just to note that decision aids really help people clarify what matters for them. Other resources that have been developed through the Australian Academy of Science, and these exist globally through departments of health and many other websites, helping people to understand what a risk of 1 in a million actually looks like. And that is what was the estimated risk of somebody dying from a clot from the AstraZeneca vaccine, for example. Other pictorial representation of the risk of the vaccine compared to the risk of the disease of COVID itself. And then on the far right, again, this was developed by ATAGI, the Australian Technical Advisory Group on Immunisation, and the government, weighing up the risks and benefits of the AstraZeneca vaccine. In the orange there, you can see by the age group is the risk of someone experiencing a clot or TTS compared to the benefit of the vaccine in terms of the prevention of severe disease. And you can see, obviously, as the individual gets older, the risk of the clot gets smaller, and the benefit in terms of preventing them getting admitted to hospital gets greater. So how do we approach a conversation with someone who has questions and concerns about vaccines? The first is to find out where they sit on the vaccine acceptance spectrum. Ask them what questions they have, because we know that everybody will have a question about the vaccine that they are considering for themselves or for their children. And we want to give people an opportunity to really express what their concerns are without jumping in and trying to correct them when they elicit or talk about their first concern. Secondly, I always ask the person if I can share what I know, establish who I am as a trusted and reputable person to be sharing vaccine information with them. So I say, I'm a specialist immunisation paediatrician. I acknowledge that questions are normal. And then I will use some of these resources and share what I know about vaccine safety and effectiveness to answer their questions. I really try to avoid over-reassuring. I avoid trying to oversell vaccine safety. And I try and find out what will motivate them to accept the vaccine and to reinforce that motivation. Is it to travel to see relatives? Is it to be able to have their child attend school safely without the risk, reducing the risk of them getting COVID in the school setting? So just really trying to understand those broader benefits of vaccination and what will motivate them to be vaccinated. Then I always pivot back to the disease itself, to talk about disease severity and not make the whole conversation about the risk of the vaccines. And then lastly, I will help them to understand where they can get vaccinated or where their child can get vaccinated, because we know that access and practical barriers are real. And so we help to explain where to get the vaccine, and if they are not ready, to make that decision at the time. Of course, if they can get vaccinated at the end of the appointment, that's fantastic. But to leave the door open, continue the conversation, because sometimes it takes a few conversations. And with a vaccine hesitant individual, I would spend 45 minutes to an hour going through this process, and many times I will invite them back to our specialist immunisation clinic to have another conversation if needed. So similar principles when we're talking to our own children or talking to our patients. If we're a paediatrician like myself, I will always answer the questions of the parent. I will find out the questions that the child has and answer their questions as honestly as I can and address any misinformation. I might share my own experience of being vaccinated and talk about those common and expected side effects in the first 1 to 2 days to really normalise the process of vaccination for the parent and for the child. And then I always set clear expectations, and for the kids, I tell them, well done, good job, and reward and praise them. So when we're communicating with friends and family, this is also often very challenging if you have someone in your family who is a vaccine refuser or is highly hesitant. Again, it's important to pick the battles that we undertake with our family members. We don't want to jeopardise our relationship with our family members, but to listen to their questions and concerns if that does come up as a conversation, rather than jumping on them and trying to correct them or tell them how wrong they are. Make them feel heard and offer to show them information, share information, trustworthy information that will help to address their concerns, address misinformation, and again, keep the door open if that is what is needed, if they can't make a decision at that time. For entrenched vaccine refusers, I've touched on this a little bit. These are people at the far end of the vaccine acceptance spectrum, and it may take many conversations before they are ready to revisit their decision not to vaccinate. The things we often do wrong with vaccine refusers is we oversell vaccine safety. We need to be honest. All vaccines have side effects. No vaccines are 100% safe. We don't necessarily have all the answers to every question, but we can help people to find answers. Often the advice from our regulators or from our technical advisory groups may change as more information comes to hand, and to explain that that's expected, particularly in a pandemic, and that it doesn't mean that the information that was initially given or distributed was wrong. Very often I'll use something called the truth sandwich when I'm addressing a myth or misinformation, where I clearly state the fact up front. Then I address the myth and provide an alternative explanation. And then I'll restate the truth at the end, because people will always remember what they hear first and what they hear last and what they hear more than once. And so you might be able to actually address the misinformation or myth in that way. And again, keep the door open if the individual is not ready to accept vaccination at that time. In terms of public risk communication, we've seen this from our government and political leaders. Communicating with the public we need to have transparent communication, be honest about what we know and what we don't know, to involve a range of stakeholders and consumers in our communication, to make values explicit and talk about how vaccines have a greater, broader benefit for the community, not just individual protection. We need to make sure that our messages are clear, people know what action to take, and that we don't oversell vaccine safety. Of course, we need to always remember to diversify our communication channels and platforms, depending on the different cultural groups, Indigenous groups, age groups. We really need to tailor the information and the communication channels that we use. Maybe for some groups, it's radio, for example. Addressing misinformation, particularly on social media, is critical. Prioritising key groups for communication, using credible spokespeople. And in our research, we've certainly found that the public want to hear from medical professionals and scientists, not just government leaders or politicians. And lastly, using data to inform action, to monitor and evaluate progress with vaccine rollouts and coverage. So, of course, the goal of vaccine safety communication, and this has obviously been critical through the COVID-19 vaccine rollout, is to empower people to make evidence-informed choices, to encourage trust in health authorities and those delivering the vaccine on the ground, to facilitate access to timely, accurate and credible information and use trusted communication channels. And lastly, to provide people with a means of asking questions and having concerns addressed. And I hope I've been able to give you some tips around interpersonal communication and more broader, widespread public communication, both on a broad scale and being able to tailor that communication with different groups. So I would just like to acknowledge Dr. Jessica Kaufman, who's a postdoc in my group, as well as Associate Professor Holly Seal and Professor Julie Leask for their contribution to some of these slides. And of course, the Victorian Department of Health, who has been part of we've partnered very closely with them around some of this research that we've done through the COVID-19 pandemic. So thank you very much for your time today, and I'd be very happy to take questions if I was there. Thank you very much.